Welcome everyone. Today we'll be discussing asthma management in the outpatient setting. We'll be discussing the most recent evidence-based guideline from the Global Initiative for Asthma, or GINA. When managing asthma in the outpatient setting, GINA 2023 emphasizes a stepwise approach combining both controller and reliever medications. You should step up therapy if control is inadequate and step down after 2 to 3 months of good control to minimize medication burden. The key update is the strong recommendation against short-acting beta agonists like albuterol, so we don't want SABA monotherapy. And this was traditionally used for mild asthma before, but now we no longer we no longer recommend using SABA. And the reason for this is because evidence shows that using SABA alone increases airway inflammation, it enhances allergic responses, and paradoxically reduces bronchodilator responsiveness over time, leading to increased risk of severe exacerbations. Instead, GINA recommends always using a inhaled corticosteroid containing controller, even for patients with mild or intermittent symptoms. It's worth noting that the NAEPP guidelines still allow as needed SABA, but GINA's stance is going to be the more proactive approach. There's also a subset of patients with low eosinophilic inflammation, defined as less than 2% eosinophils in the sputum, and these patients may not respond well to inhaled corticosteroids. And so for this patient population, alternative therapies or phenotypic targeting may be needed. Finally, don't forget non-pharmacological measures like smoking cessation, physical activity, immunizations, breathing exercises, and weight management, especially in obese patients, because these can significantly reduce symptom burden and the exacerbation frequency. Now let's go over the preferred asthma treatment regimen step by step according to GINA 2023. So this table is going to outline the preferred controller and reliever at each level of asthma severity. And we're going to see that this table is reflecting a major shift in how we approach asthma today. So as we discussed before, asthma management is going to be based on stepwise therapy, where treatment is adjusted up or down depending on the level of symptom control. And so this is going to be broken down into 5 steps. Now, before starting these steps, let's just go over some terminology. Controller preferred is going to be the first-line evidence-based daily medication choice for a given step of asthma severity. These are meant to be taken regardless of current symptoms, even when the patient feels fine. So regardless of how the patient is feeling, they're going to be taking these medications. Reliever preferred is the as-needed rescue medication recommended for managing breakthrough symptoms such as wheezing or shortness of breath. Now let's start with step 1. So step 1 covers patients with infrequent symptoms. There's no daily controller. Instead, the preferred reliever is low-dose inhaled corticosteroid formoterol used as needed. This is going to be providing both bronchodilation and anti-inflammatory benefit during symptoms. So the major change is that we no longer use SABA alone at any step. So no longer any short-acting beta agonist like albuterol at any step. And as we discussed before, GINA moved away from SABA monotherapy because SABA does not treat underlying inflammation. And so this can lead to increased risk of uncontrolled asthma and exacerbations. SABA only provides temporary symptom relief without addressing the underlying airway inflammation that goes on in asthma patients. Step 2 is indicated for patients who have symptoms more than twice a week, but not daily, nighttime awakenings 3 to 4 times per month, and more than 2 exacerbations per year. Lung function remains normal in these patients, and surprisingly, the preferred control for this group is still listed as none because the entire treatment is as needed low-dose inhaled corticosteroid formoterol. This is going to be a symptom-driven anti-inflammatory approach. Now let's move on to step 3. Step 3 applies to patients with symptoms on most days, nighttime awakenings at least once a week, and baseline FEV1 between 60 to 80% predicted. These patients have frequent exacerbations and they need more robust control as a result. And this step is going to mark the shift to a daily combination inhaler for both control and rescue. So once we reach step 3, we're going to be initiating maintenance and reliever therapy, or MART. This means the patient uses low-dose inhaled corticosteroid formoterol both daily and as needed with a single inhaler. Now let's move on to step 4. Step 4 is going to be for patients with daily symptoms, nightly awakenings, frequent exacerbations, and FEV1 less than 60% predicted. At step 4, we continue MART, but we're going to be stepping up to a medium dose inhaled corticosteroid formoterol. And so this combination is still going to be used for both maintenance and relief. Step 5 is going to be including patients who remain symptomatic despite step 4 treatment, or they have particularly severe disease. In this step, we continue medium dose inhaled corticosteroid formoterol, but we add LAMA, typically tiotropium, and we also assess patients for biologic therapy based on phenotypes such as eosinophilic or allergic asthma. These patients should also be referred to a specialist. So across all steps, inhaled corticosteroid formoterol combination is the preferred reliever. And the key takeaway is that Salba is no longer preferred anywhere because, again, it doesn't address the underlying inflammation that goes on in asthma patients. And so as a result, it can increase the risk of severe exacerbations when used alone. So thank you for watching, and hopefully this video was helpful.